We're on. Good morning, Facebook viewers. Good Monday morning to you. City Council Pop Barnes with your health or community tip for the week. And I'm here with the Integrated Health Partners like we are every Monday. And I'll start with, we have Tree of Life Healthcare and New Horizons Behavioral Health, and along with Ms. Susan Gowder. And we have a special guest that I will introduce once our integrated partners introduce themselves. And if you're looking at Andrea, she's taking a vacation trip that she really needs to be taken. Yeah, right. She's going to another virtual meeting. So Reverend Clyde, I have you introduce yourself this morning to our Facebook viewers, and then you can pass it off to Andrea.
Good morning, Facebook viewers, I should say, excuse me, Monday morning. Thank you for being here with us. Thank Council Barnes for allowing this to be on board, and we welcome you to Tree of Life Healthcare as well. And Andrew, it's on you.
Andrea, it's on
you. Good morning,
you.
everybody. What'd you say, Pops?
Hey, look, couldn't be better. I'm going to tell you a little joke as soon as you pass it to Susan. She's the resident musicologist, you understand?
Good morning, everybody. It's such a pleasure to be here with everybody and all these bright and smiling faces. And this is so this activity that we're doing is so important that I'm not going to be able to stay the whole time, but I just had to pop in and tell everybody hello and welcome our guest who will be introducing himself shortly. And remember, be good to yourself and take care of your health, everybody.
Yes, yes.
And now you want me to toss it to Susan?
Yeah, let's put Susan on there.
Oh,
all right.
Good morning, everybody. I hope you enjoyed your Labor Day holiday. The last time we met on Facebook Live was August 31st, and we talked about Recovery Rocks. And I want to show you, here is one of our Recovery Rocks. These beautiful original pieces of art will be placed on the walking trails around town. If you find one, there's a website on the back and they're numbered. Each one of these little Recovery Rocks gets a door prize. So make sure when you're out walking in the parks around Muskogee County that you keep your eyes peeled for one of our Recovery Rocks and can win a good prize.
I think that's awesome. That is awesome. Now, Facebook viewers, let me just tell you something. I could dance a little bit, even with this little arthritis. I'm not as quick, don't have that same movement. But let me tell you something. There was a song back in 1983. I know Susan, she's a musicologist.
Uh-oh.
I used to like to hear when we played it off of a military station. It was called Wet My Whistle, Wet My Whistle by Midnight Star. When that came on, boy, I just started to move and rock, and I just loved the beat and the drums and all. Well, let me tell you something, our viewing audience. When I went to Dr. Stephen Cooper's office, all I went there was to wet my whistle with a little bit. He was going to tell me about chiropractic practice or something. And him and his staff ended up drowning me with all this good knowledge that I can't wait to share with you. So Dr. Cooper, Stephen Cooper, I'm going to have him introduce himself. He's our special guest for today. And he's got so much stuff. I told him to do an overview on all of it and then highlight 2 or 3 of them today because there's so much stuff. He's going to be coming back on the 3rd Monday in October and the 2nd Monday in November. And so I'm going to pass it over to Dr. And don't drown me no more when I come. Let me know to bring a life preserver or something.
Well, Pops, first of all, I want to thank you for inviting me to this. This has been great, be here with you and Dr. Clyde as well. And I know we lost Andrea here real quick, but and Susan. In fact, I kept thinking Susan was so bright in color, I had to add some color to my picture here with all those colors she had on. I just feel like maybe this is black and red. I need some more color on me. But what an awesome day it is.
So let everybody know where you're at, everything about you. Well, your office in Phoenix City and also in Atlanta, so they know how to get in contact with you. Be sure to go do that a couple of times while you're. So I want them to come see you with all that good stuff you got.
Yeah, well, I'll tell you from the very beginning. You know, I was born upside down and naked and back. You know, but no, I'm originally from Detroit, Michigan, but I've been here since '92. And started over in Columbus, and then we moved our offices over here to Phoenix City in '05. Since then, we grew from a little 1,400 square foot single shop to today we have over 14,000 square feet in offices,
Wow.
2 different clinics. We have, 2 different locations. We have a total of 5 different clinics, 2 chiropractic offices, 2 medical offices, and a full ambulatory surgical center. We have a total of 8 different providers and 14 full-time staff. And
wow.
and so we've been going at it for a little bit. And yeah, we've added more services, and as the ways to treat people, as the ways to affect people's health continue to change and grow, and new technology or new things are added, we wanted to continue to add those to what we do, and
Alrighty.
add a more holistic way, and to bring in as many other professions as we can, so that at the end of the day, we can provide a way that someone can come in and get the best of both worlds that we could possibly provide. So
Sounds great.
yeah, the first screen that's up there just pretty much lists our different clinics, our offices, what we have in in Phoenix City and South Atlanta, the Phoenix City Spine and Joint, Phoenix City Rehab, South Atlanta Spine and Joint, South Atlanta Rehab, and the South Atlanta MUA Center. Now, that office in South Atlanta is in Forest Park, and one of the things we try to do is to focus on helping you be the best that you can be. That little moniker there with the next slide, the one with the, I think she went one slide too. Yeah, there you go. It's not pain management, but pain solutions was something we thought of a while ago.
I like
think people are
that. I
so
like
caught
that.
up in pain. Yeah, pain is a major driver. That's what brings people into the office many times. I hurt, but if you think about it, pain isn't really the problem. Without it, you wouldn't seek care.
That's
Pain
it.
is a symptom. And many people, unfortunately, treat their health care based upon their pain instead of realizing that the problem occurred long before they felt the pain. It's the last thing to show up and the first thing to go. And so what we want to try to do is get people thinking about health care. You say health care isn't for everybody, right? And they say, well, what do you mean? I don't mean that sick care is what everybody goes after. Health care is something that you need to educate yourself and go
Exactly.
about things a little bit differently. So, but you can go to the next slide and we can go from there. Next one, what I try to do is break it up between Phoenix City and South Atlanta. A lot of things are similar, but there are a few differences as we have some different staff. But in Phoenix City, we list chiropractic, digital x-ray, integrated care, physical medicine. Our arthritic knee intervention is something later on we'll get into as well. Joint therapy, PRP, and stem cell, which I know we'll spend a whole time on that down the road. Vitamin infusion, I hope to get to a little bit of that today. DLT and medical exams. We do drug screening as well, auto accident intervention, and concussion studies.
So, viewing audience, you can see why he drowned me. He and his staff drowned me with all of this. I wasn't even expecting that. So I'm just so glad that I did, because now we're able to share that with you.
And we appreciate that, Pops. What we've tried to do is when someone came in and we found that they had needs, we wanted to be able to fill them, and wound up happening. We wind up continuing to grow. And here's the South Atlanta office. That office is close to 9,000 square feet by itself. And again, it has a lot of the same services, but it also boasts that surgery center. So we can do manipulation under anesthesia, which we will talk about a bit today there as well as we have an interventional pain specialist there. But a lot of our injections there, spinal injections and whatnot, are mixed in with MUA, and we also try to do it with stem cell. And MUA stands for manipulation under anesthesia, and we'll have a lot of fun when we get to that, because a lot of folks don't have a whole full understanding of that. But you can hit the next slide. We'll go from there. In fact, I'm going to do this way so I can keep track. But chiropractic care, and I think this is what you meant by, do I have a full understanding of it? Yes or no. Chiropractic care and its ability really to keep the brain in communication with the rest of the body, to help it to be able to communicate to the body. I think we were talking earlier about, if you want to move your big toe, your brain has to be able to communicate with it now, right? And to do that, there's a series of nerves that go from the brain to every tissue in your body, including your big toe, your heart, your lungs, even your arteries. You know, for your arteries to contract or to expand, which actually controls your blood pressure, your brain has to be able to communicate with it. Now, there's also your endocrine system and other systems as well. But for the nervous system part of it, you know, that means that a nerve has to travel from your brain through a series of bones, through several muscles to get to that tissue. And anytime that whether the bone not be in the right place or the muscle is overly contracted, so it begins to squeeze the nerve, you begin to experience problems. We call that problems dis-ease or disease. And so when you start the dis-ease process, what we want to do is deal with it then before it continues to develop into other issues. And so that's kind of how we're set up. In chiropractic care, we do a lot of education because we want folks to understand that whole process. It's not just, and yeah, we do get a lot of folks who come in, I've got severe migraine headaches. In fact, one of our doctors was at a seminar this past weekend and brought in some very interesting things. There was a research project that a dentist had did, because we do a lot of TMJ stuff, so I wanted him to go there and look at some things for the jaw. But one of the serendipities, one of the things that came out of this was they did some dissections a little bit differently, and they found that there was a tissue that was connecting part of the spine to the dura mater. I'm going to go a little bit in the woods, but I promise I'm going to keep this real basic. The dura mater is this tissue that surrounds your spinal cord and surrounds the brain. It's protective, it feeds it, it does a lot of different things. But never before did they find that this tissue connected directly from a certain muscle, the capitis muscle. You know it when you have a headache, you feel this thing in the back of your neck, say, oh, that goes right from that to this matter. So now we know that the positions of the bones and the muscle in the spine have a direct result to you having headaches and you having migraines on some of these tissues. So now they found the link. So these types of things that we've been talking about in chiropractic for years are now, the more they do research, the more they look at it and say, wait a minute, this is the connection. Now we see it. Right. So when we can resolve these things by resolving those issues, then we can help you get better without some of the other more aggressive forms.
Exactly right. And that's all.
Right. Doesn't solve everything. There are other things that can cause headaches, but for a lot of people, it's a big issue. And you know what? I'd rather go conservative before I go more aggressive. But the next slide kind of is where it brings it all together when we talk about physical medicine, because now in this case, we're talking about functional medicine, which is what our medical providers do here and chiropractic together. They're focused on your ability to move, your ability to walk, your ability to move your shoulders, your ability to do the things that you need to be able to do. Right. You don't do a whole lot with. They do manage some blood pressure and diabetes and things like that. But really, we send that out. We're a functional medicine office. We want. Here's what I believe. Here's what we believe. If you're out and you're exercising, and you're walking, and you're doing the things that you want to do, you're out playing tennis, you're out doing those things, you are going to be healthier because movement and motion is life. When you can't walk and you are sitting at home, you can't do the things you do, typically there's weight gain, there's blood pressure increases, you have these other issues. So our gift is to try to get people to do the things that they want to do, that they're able to do, and thereby prolong their life and their quality of life through motion and through movement.
And I'm going to be honest with you, doctor. I have arthritis, a lot of arthritis, but the one thing I learned when in the military, the physician said, Sergeant Barnes, you're going to have to just move. And you want to know something I did? When I started moving, the endorphins started to kick in. I started feeling good, started feeling like I was 20 when I was 40. You understand? And it just makes you feel really good. So it's about encouraging and having individuals to sustain the ability and things they were doing prior to feeling that pain and whatever. So you're 150% correct.
Yeah, absolutely. In fact, a long time ago, you shared a story coming on about your, dancing and moving, but can't move as fast as you used to. Back, what they used to say is, no, you just need to play slower music. But you can go to the next slide. But the next slide is just it, arthritic knee and shoulder. We developed a whole program, And we were talking about this earlier where, some people have had Hyalgin, which basically is a gel that they put into the knee or into the shoulder, which provides lubricant or the space so that that shoulder or knee can move like it's supposed to move. The challenge is when most doctors do it, they do it what I call blind. They take the needle, take the Hyalgin, they put it in and inject it. Research, documented research, you can look it up, it's shown 35% of those injections, the needle never makes it into the joint capsule. So if the needle doesn't go into the joint, capsule, it's then, pushed in, and patient feels a lot of swelling around their knee, a lot of pain. They say, well, that didn't work for me. Well, of course it didn't work. It never went into the knee.
Exactly.
So we do ours. We have a C-arm, a fluoroscopy unit. So when that's being done, both the patient and doctor are actually watching the whole process. So we know we're in the capsule. And so that when the drug or when the Hyalgin is delivered, we know what's into the capsule. Now, Hyalgin is an inert type of a medication. There's no side effects. It's just a gel. It's not going into your body doing anything else other than giving it lubricant and giving it space. But the other thing we do before we inject that, we inject the dye. Why is that important? The other 20% reason why it doesn't work is because the capsule isn't patent. And what we mean by that is that the capsule may have a tear in it. If we inject that dye and we see the dye floating and coming outside the capsule, going down the leg, then we know the capsule as a whole. We've got to treat that first. So if I just go in and I go in blind, and let's say I do get into the capsule, and I go ahead and I squeeze the medication, the Hyalgin in there, but you've got a hole in the capsule, it's going to squirt right out. So we haven't done anything to resolve the problem, right?
Now, let me tell you, that was one of the biggest things when Melanie was taking me around, and she explained that to me. You want to something that makes a lot of sense, because many patients will go get an injection. If it doesn't go into the capsule, they don't feel any relief. They feel that nothing's happening, that nothing's going to be beneficial to them. So when Melanie showed me that Star Trek looking thing there, she explained to me what it was, that caught my attention, because it's common sense. You want to make sure. And what I liked about it, the patient can actually see, this is what really caught my attention, the patient can actually see the injection going into the place where it needs to go.
Correct.
Let me ask a question now. So what is the process for the first knee injection?
Oh, good question. Basically, when they come in, the medical doctor or the PA or nurse practitioner is going to do a full evaluation. They're going to shoot x-rays. We have digital x-rays. We're going to look at those first. And there's certain signs we look for: the degeneration or bone spurs, loss of joint space. Those are things that are very easy to see. Remodeling. The bone is beginning to change because you're striking bone on bone or things like that. So we're going to look at that first, because that's the first clue, obviously, that there's degeneration going on. We start to see that joint space, and typically a lot of doctors say, well, it needs to be bone on bone before we do it. I'm of the mindset of, why wait until you're bone on bone? If you're using joint space, if we can get that proper today, you never get bone on bone, and you never have to slow down what you're doing. So we're not trying to wait till there's disease. We want to get to it early.
That's exactly right.
It needs to be.
Right.
So once those things are found, then they do an arthrogram. That's when they go in, they inject the dye. They also do a little biopsy. They look at the fluid, make sure that the fluid inside the knee is, like it should be. If that's all good, then they'll inject the dye. They'll check to make sure everything is good to go there. Then after that's done, then they proceed with the Hyalgin. Now, there's some people that may get, and we'll talk about later, PRP or stem cell. That's a whole different conversation, because there's other considerations that need to be done before we get to that point. But for the basic part of it, just dealing with degenerative knees, and actually we've done some on shoulders with degenerative shoulders. Same thing. We've got a capsule, we've got a joint, we can get bone on bone, we can grind it, we get arthritis. Why they don't do more of that in the shoulder, I don't know, but it's worked just as well for our patients as it has for the knees. And we've got a couple we've done for hips. And there's some research, there's more and more doctors doing it for the hip. There's some other things that come into play. But bottom line is this: if that joint's not moving properly, then we're going to get altered gait, or they're going to walk differently. That's going to lead, guess what? Back pain. Then they're going to have back pain because they had knee pain. And now they're going to wind up with a herniated disc because their hip was hurt.
That's exactly. It's escalation.
Now they go in and get their back viewed when they had a knee problem. So,
And I'm really glad that you talked about not waiting, because when you do have that bone on bone, you have that what osteophyte formation, bone forming while banging together, bone growth, and that causes even more pain. And so I tell you, you have to be thinking ahead of the curve, as you all are there. And it blew me away. And I'm so glad that you're giving all of our viewing audience this really, really, really good information to let them know how good you are taking care of your patients.
we appreciate it. What I like to tell a lot of people is, believe it or not, the body actually works together.
No, really, about it.
Dr. Clyde, you had a question?
No, I was excellent information. Good for people to understand and know the importance of chiropractic service and what it offers now. The advancement as far as what you all accomplished 10, 20 years ago was just outstanding.
Right.
I appreciate that. Yeah, when we bring in, and what's neat, we have a little thing that we show sometimes where I'm sitting there, our other chiropractors sitting there, our medical doctors are there, our PAs are there, and we're discussing, okay, what about this patient? What can you do? What can we do? And I think that's important. I think that's what's missed a lot of times, is that, everybody thinks, well, I can do everything here, or we can do all that. How about what can we do together?
There we go. That's exactly right.
If I go ahead and do this for the knee, it stops hurting, but I haven't adjusted the knee. I haven't lined the knee up properly. I haven't lined the ankle up properly. I don't have the hip lined up properly. I've only addressed half the problem. And so we've got the other fact I'll talk about when we get to MUA, a very interesting case that actually she's going back, but we just did her procedure 2 weeks ago. And I think this one will kind of bring it home. But PRP and regenerative health, so next screen is up there. And that's, I'll tell you, there's a lot of places that are doing that and charging people way too much for part of it. But I believe this is something that needs to be more involved in our health care on a regular basis. We need to move away from, when we can, the steroid injections and the dexamethasone. We have it here. We've had to use it at times. But what I'm saying is this. It does. Dexamethasone, the steroids do have a side effect. They do increase blood sugar levels. We know this. If you're a diabetic and you get it, we know your blood sugar levels are going to increase.
They're going to go high.
Benefits too. Yeah, but guess what? If I can use other medications or other types of things, if I can use PRP and get a better or same result without the side effects, the long run benefit is going to be so much better. Regenerative health means not giving up, as far as I'm concerned. It means that we might actually be able to build some of this back, may be able to spark growth and to bring a tissue to start healing itself, rather than just breaking that tissue down so that it doesn't hurt anymore because the nerve endings have been affected or things like that. What about actually helping it to heal, which is what the body is created to do? Whenever we do something to stop something from functioning because of pain, we pay a price later on.
Yes.
And it's that price later on that winds up in more and more and more knees needing to be replaced and shoulders being replaced and all these other issues. What if we can address it differently? And that's all I'm saying. I'm not saying that every knee doesn't need to be replaced. Some of them do, without a doubt. They've gone way too far and too long. But many times we can prolong and people can enjoy much more freer movement with their natural needs that they were given when they were born if we approach some of this a little bit differently.
And I like the fact
that protein-rich plasma, I guess that's what it is.
Correct.
And stem cell. How does it, as far as how does it work and what is it for our audience?
Yeah. This is an interesting thing. I was going to save a whole thing to go really, really deep into it because we approach some of it a little bit differently. And in fact, I like to even bring in a specialist that we use up in Atlanta that is out of this world in his assessment on how he does it for the spine, because that's another whole aspect that I don't think gets appreciated as much. I'll talk about it as far as the knee things, how we do it here in this office and go to there. But when we talk about ligaments and we talk about discs or we talk about a meniscus, the cells which help us to heal that are in our plasma aren't in those tissues for the most part. They're not there. So when it begins to degenerate, there's nothing there to help it to regenerate. So it just goes in one direction, and that's downhill. right? It lacks blood supply, at least enough blood supply to encourage any significant healing, which is why so many times basketball players or football players, whatever, when they have meniscus issues, it can be a major, major problem for their career. But then you look at somebody like Adrian Peterson, right? The Asian. There's something going on there in the background.
Yeah, I hear background noise, Susan.
Oh, I'm sorry.
I hear a lot of background noise.
I'm sorry.
But we call him the Asian wonder, and Adrian Peterson said, how in the world is his meniscus back to 100%? How is he run like he's running easy? He went overseas and got stem cell put into that meniscus so it could regrow, and then he could bring the muscles around it. The problem is that for a lot of places, they say, well, how do I get that? Well, a lot of people are getting PRP, which is decent. But PRP is taking your body's own plasma, spinning it down, taking that, and then injecting that back into those tissues. So if you're 30, you're going to heal like you're 19 or 20, which is pretty good. If you're 40, you're going to heal like you're 30, which is pretty decent.
Right.
If you're 50, you're going to heal like you're 40, which is okay. As you can
see, keep talking. I like what you're saying.
Right. So as we start getting older, the benefit of PRP decreases a little bit because there's less of those cells in our bloodstream to begin with. And then we start talking about, well, maybe amniotic tissue or stem cell tissue, other fluids, things like that, which now we bring in amniotic tissue. We've got a lot more of those cells in it, so we're going to get a lot more healing. Yeah, it costs a bit more, but it's, it depends on what you're doing. If you're not out running around doing a lot of things, PRP may work for you. So there's a lot more that goes into that, and we try to make sure we marry the right treatment. I don't want somebody paying all this money to get stem cell, or I shouldn't even say stem cell, exosomes and things like that, which create stem cells from daughter cells. And again, we get way deep weeds on that. But anyway,
what piqued my attention was the fact that how well you're thinking outside the box, because everyone automatically wants to do steroids and one thing and another. And always there's side effects. You have to think about the person's metabolic functions, diabetes, high blood pressure, things of that nature. So it really piqued my attention. And I know later on, probably in the next time you come on, you're going to be talking about some of the other herbal things that you use, the natural things that you use in conjunction with this here, and that works really a lot better. Mm-hmm. And so what we've got, Doctor, we got about 5 minutes to go, and you have given us so much information. And I'm going to tell our viewing audiences, guess what? We've only scratched the surface of what Dr. Cooper can do. His clinic is just off the chain marvelous. And what I like about him is that he and the group, the other professionals, they think outside the box for you. And that's what really caught my attention and really blew my mind with all the modalities. Now, you'll see up here on the screen, it says IV therapy. We're going to probably have to go with that our next time because we got about 3 minutes to go. I'd like for you, Doctor, to tell all our viewing audience where you are located at so that they can start taking advantage of this good care, both your office here in Phoenix City and also in Atlanta.
Yeah, in Phoenix City, we're 3700 South Railroad Street. We're right near the Walmart here in Phoenix City. If y'all know Dr. Chandra's office, Dr. Dem, they kind of blanket us on either side. We're the two clinics right in between. And about 60% of our patients are Columbus, and the rest are from here in this area. Then we go up to Forest Park, and that's where the other office is. And Forest Park, we can see airplanes land and take off. We're right there by the airport on Forest Park Road, and that office is 541 Forest Parkway, suite number 14. And we're there Monday to Thursdays, and we're here Monday to Fridays. And one last thing, just to kind of tease it, that IV thing, I will tell you, when COVID hit, the first thing I thought about is people with digestive issues. How do we get their immune system boosted to help to fight off these different things? And I'm going to tell you, that is a big issue for a lot of folks.
Yep. That's going to be the teaser. That's your teaser for October. To let people think about that, because you and I had discussions about this. That's going to be the teaser. What is Dr. Cooper doing as far as that's concerned? So y'all latch on to that. The third Monday in October is when Dr. Cooper will be back with all these good treatment modalities that he has in his clinics here in Phoenix City and in Atlanta. And so until next time, next Monday, we will be here. As I always say, please be good and kind to yourself because God loves you. Bye-bye now.